Getting a diagnosis of dementia. If you or any member of your family or someone close to you has any concerns about changes in memory, communication, personality, or behaviour, do consult your GP as soon as possible. Your GP will look to identify potentially treatable conditions that may look like dementia, and some of those are depression, vitamin deficiency, delirium, which we'll talk about at another session, stress, thyroid problems, infections, or problems with the blood supply to your brain. And these can all affect a person's alertness, memory, or brain function. Why is a diagnosis important? Well, it can be scary to get the diagnosis, but it is important to find out for the following reasons. For some people, it can be a relief to know what their condition actually is and why their memory, behaviour, or the way they feel is changing. A diagnosis also benefits the wider family and enables them to understand what's happening and how they can help. Additionally, a diagnosis helps the person with dementia and their family to get the best treatment, support and plans in place as soon as possible. So this could include looking at finances, legal issues like lasting power of attorneys, and making decisions for the present and the future, which we call advanced care planning. A timely diagnosis can help the person stay well for longer by increasing their awareness of the condition and how they and their family can make adjustments to improve their quality of life. And although we don't have a cure for dementia at present, there are some medications and other interventions that can be used to help manage and lessen the symptoms. So what are the possible signs and symptoms that may indicate a person could have dementia? There could be a change in short-term memory, thought processes, concentration levels, communication, comprehension and word finding, motivation levels, the ability to perform everyday tasks. Personality could be affected, mood, behaviour or social functioning. So all these signs and symptoms may be due to potentially treatable causes. And it's only when all of these are ruled out that the possibility of dementia will be looked at. So it should never be assumed that one or more of these signs and symptoms is definitely indication of dementia. So, how is a diagnosis made? As previously mentioned, the GP will look to assess whether the person has a treatable underlying condition. The GP should also conduct an examination, do some blood tests, and ask questions to reveal physical or psychological conditions, which could be the reason for the signs and symptoms experienced. In addition, the GP should also ask when the symptoms started and how these affect everyday living, and whether these problems started suddenly or more gradually. It may be helpful to have a family member or a person who knows the person well present at this stage, so they can say what changes they've noticed and how this affects the person and the people around them. The GP should also briefly test the person's memory and cognitive abilities, asking the person to state what day, date and year it is, name some common items from pictures or as answers to questions. Remember and repeat items to test concentration and short-term memory, and to complete a drawing, and this will test different areas of the brain. So if all physical or mental health conditions have been ruled out as possible causes of the changes in memory, behaviour and personality, the GP may then refer the person for further investigation. In our area, we have the Memory Assessment Service. Now, this service will then take a detailed medical and family history from the person with symptoms of dementia. And again, it is helpful if a family member or someone who knows the person well goes to this appointment, and speaks with the person conducting the assessment to help with this process. A more thorough cognitive assessment will then be undertaken. This will comprise of testing attention, memory, verbal fluency and language, and also visuospatial abilities. They will want to know how the person's getting on with everyday tasks such as shopping, housework, driving, self-care, washing, dressing. And then lastly, the memory services will request an MRI or CT scan to examine the brain for any abnormalities. So what should you do if the person will not go for investigations or tests? The person may be feeling frightened of getting a diagnosis, and they may feel that they'll lose their independence or have to go into care. In some cases, they may not understand that there are concerns about their memory. They may lack insight into their condition. And then they may deny that they have a problem. In that case, we need to reassure the person that the symptoms may be due to another potentially treatable condition. And this in turn may mean that they'll be more willing to visit the doctor. If the person simply refuses to go to the doctors, you can contact the surgery to explain the situation. The GP may be able to provide a home visit to speak to the person about their symptoms. And families can always contact the Admiral Nurse Helpline to discuss any difficulties that they're having around this issue. So thank you very much for listening to the podcast. I've attached on this slide my contact number should any family carers wish to get in touch with me, and also the number again of the Admiral Nurse Helpline service and their opening hours, and also of the Royal British Legion Admiral Nursing Service.